Hi, I'm Laura Neilson from the Shared Health Foundation, and I'm really excited to be here at Pathway this year telling you all about families who don't have a home. And when we talk about temporary accommodation, it can be anything from a hotel to a B&B to a short stay, but it is not a permanent home. And unfortunately, these children are hidden in plain sight. I first noticed this about 5 years ago when, through my work in primary care, I noticed that there were families who were moving and into temporary accommodation, and it's the first time that I'd really seen it. But it was so hidden. It took us a while to find out about it. It took us a while to unpick what was going on, and suddenly I started to realise that the scale must be a lot bigger than I thought. And since then, we have been campaigning for change for children who don't have a home. These children, as I said, are hidden in plain sight. They are at your school, they are in your playground, they are on your GP register, and they are definitely part of our society, but we do not talk about them. The families themselves often feel quite ashamed. They are completely stuck and completely hidden. And the problem is getting worse. The number of children in temporary accommodation is rising, and rising quite quickly at the moment. The factors that put you into temporary accommodation are complex and numerous, but it is a failure of our public systems. So one common story is for women to be fleeing domestic violence. So often when they're pregnant, sometimes they have another child already and they're pregnant, and we know that domestic violence escalates during pregnancy, and so it's not uncommon for us to see women leaving in that situation. Another thing that's causing families to go into temporary accommodation is at the end of the asylum system. So if you are given leave to remain and given refugee status, then you're given a very, very short amount of time to leave your home office accommodation and land somewhere. And you, of course, might not have the infrastructure. You're very unlikely to have the infrastructure to be able to navigate that. And so that is another group of children who are ending up in temporary accommodation. A third group of children that ending up in temporary accommodation is really a complication of our benefit system, the universal credit and the cost of living. We are seeing more and more families who a couple of years ago would never have found themselves in the situation where they're being evicted. And either that can be through no fault evictions where the rent suddenly goes up and they can't afford it. It can be that their property is being sold, or it can be that they've got behind on their rent and therefore they are evicted. Just in the last 2 weeks, we have had a mum discharged from hospital with a brand new baby into temporary accommodation with nothing. We've had a teenager and his mum turn up at our centre who've been evicted, and they've come after school and they literally have nowhere to stay that night. He's the same age as my child, and I looked in his eyes, and he's 14, and you could see the fear in them. And we've had women turn up with toddlers in tow, with babies in tow, with 3 bags of clothes, and that's all they have. And this problem is entirely and utterly predictable most of the time, and we can and should do better. Of course, there's a high level of stress associated with living in temporary accommodation. There's trauma. We talk about lifelong trauma and lifelong events. This is definitely an adverse childhood experience to be made homeless and to be living in temporary accommodation. We see children with attachment issues who have delayed milestones. They're missing school, they're missing health assessments, and they're missing education. And we've known this for a long time. So together with Just Life, we've formed the all-party parliamentary group on temporary accommodation, and one area that we're looking at is children who are living in temporary accommodation. And earlier this year and last year, we asked for a call for evidence, and we were absolutely swamped by the stories we were told. We were sent videos of rats jumping out of toilets. We were shown the most horrific living conditions that people were in. We saw situations where there just weren't enough beds for the people who were sharing this accommodation. And I think what for me it showed was that what I was seeing locally was being replicated across the country, and it cannot remain hidden any longer. As part of that review, we asked Professor Fleming from the National Child Mortality Database to look at whether there was a link between child mortality and living in temporary accommodation. And as a doctor, I did not expect to find anything. We asked because we're curious, we asked because we're nosy, and I never expected to find what they found. They found that 34 children had died as a result of temporary accommodation in the last 3 years. That's 34 children. And it's likely to be higher because of the methodology they had to use, because previously when children died, we haven't been asking and recording routinely about their social living circumstances. But going forward, we are, the team is, and implementing that. 34 children. If this was another medical disease, if this was an infection, if this was something else going on, my profession, the medical profession, would be in uproar about it. But this is hidden, this is insipid, this is silent. And the trauma is huge, absolutely horrific. And this is totally and utterly preventable. These deaths should not and do not need to happen. And so there are things that we are calling for to be implemented immediately. The first one is cots. A cot is not a luxury. A cot is a life-saving piece of equipment. We know that babies who do not sleep in cots are significantly more likely to die of sudden infant death syndrome. And we know that women going into temporary accommodation with their children most of the time are not provided with cots. There is no obligation on anyone to do this. Who is going to provide the cots? Hoteliers, landlords, councils, I don't mind who. But every child must sleep every night in a cot, and there must be space to put a cot in the room that you are housing this child in. Secondly, we want access to food and cooking facilities. Most temporary accommodation doesn't have adequate cooking facilities. It might have a kettle, but it doesn't have a fridge to store medication. It doesn't have a microwave to be able to cook meals. It definitely doesn't have a kitchen. And if you're living in this temporary accommodation for months and months and months, how on earth do you feed your children? You end up going to takeaways and you end up eating very fast food, and it's very expensive and deeply unhealthful. So we want access to food. We also want access to education. We know that huge numbers of children fall out of school when they go into temporary accommodation. Often their temporary accommodation is miles away from where they were living. Sometimes for good reasons, if they have to flee domestic violence, but often not, often just because that's where the accommodation is. And they struggle to get to school. We want to see free public transport for children living in temporary accommodation so they can get to school and their parents. There's no point giving the kid a free bus pass if mum can't get on the bus with them. And we want to see access to education given the same concern as looked after children. So that if you're living in temporary accommodation, you must have a place at school. School is where you learn, school is where you socialise, school is where you do your safeguarding. School is the safest place for our children. And our most vulnerable children, it's even more important. We want these kids to have access to education. The average amount of time lost in education is over 9 months. That's like doing a lockdown over and over and over again. It is not acceptable. We're calling for safety. We want safety gates, cupboard latches, all those things that prevent accidents and injuries in this accommodation that these children are being housed in. And we're calling for an urgent review of the safeguarding risk for mixed accommodation. We know that often single men who are homeless and have been street homeless have a multitude of issues. They are hyper vulnerable and they need their own care. These two groups should not be mixing. We do not want these two groups mixing together, and I am deeply concerned about the safeguarding risk of putting young families with this in a completely unsupervised environment. We've had evidence of women not being able to lock their room doors, of being propositioned at night. We've had teenage girls tell us about how they've been followed to the bathroom. We've had teenage girls asked if they want to go out. We've had stories of teenage girls being offered to start selling drugs and trying to be groomed into prostitution. This cannot happen. This cannot happen. Unfortunately, I practice medicine in Rochdale and I picked up the pieces of the Rochdale grooming scandal. And I will not see another scandal like that on my watch in temporary accommodation. Enough is enough. We're also calling for a notification system. At present, if you go into temporary accommodation, no one knows you're living there. Your doctor doesn't know, your school doesn't know, your health visitor doesn't know, the police who are trying to protect you from DV don't know. We want an automatic notification system so all those agencies can do their bit. Most of us looking after these families want to do a good job, but we can't if we don't know where they are. We can make sure they get medication. We can make sure that they get their inhalers. We can make sure they get their creams for their eczema. We can make sure that mum has her antidepressants. We can do all this if we know where they are. And finally, we're asking for support for every family who goes into temporary accommodation, and meaningful support. We have piloted the Healthy Gems Hub, which is just amazing. It's a combination of practical help with cots and nappies and food and love. And it's also a massive support for how you navigate the system. We know it works. We've had hundreds of contacts. We get referrals from lots of different types of people in Oldham. It's a nice, welcoming, safe space. And we want to see this replicated first of all in Greater Manchester and then beyond. We want to work with anyone who wants to do this. And so today I'm asking Conference to support us in changing the reality for temporary accommodation families, for children who have no home. This should not be happening, and we should do everything we can to prevent it. But when it is happening, we have to reduce the risk. We have to mitigate. We have to put the children at the centre, and we have to show them that they are important to our society. 34 children, most of them under 1, most of them babies, most of them tiny, dying as a result of living in temporary accommodation. Enough is enough. No more.